Jaundice. Types, causes, symptoms, and treatment. 1. Introduction to jaundice. Jaundice is a medical condition marked by the yellow discoloration of the skin, eyes, and mucous membranes due to excessive bilirubin in the blood. Bilirubin, a byproduct of red blood cell breakdown, is normally processed by the liver and excreted in bile. When this process is disrupted, whether due to excessive red blood cell destruction, liver dysfunction, or bile duct obstruction, bilirubin accumulates, leading to jaundice. This condition can affect individuals of all ages, from newborns to adults, and often signals an underlying health issue requiring medical evaluation. 2. Types of jaundice. Jaundice is categorized into 3 main types based on the underlying cause. Pre-hepatic hemolytic. Jaundice occurs when excessive red blood cell destruction overwhelms the liver's processing capacity, leading to high unconjugated bilirubin levels. Hepatic hepatocellular. Jaundice results from liver damage, impairing bilirubin conjugation and excretion, causing both unconjugated and conjugated bilirubin to rise. Post-hepatic obstructive. Jaundice arises when bile flow is blocked, preventing bilirubin excretion and increasing conjugated bilirubin in the blood. Identifying the type is crucial for proper diagnosis and treatment. 3. Causes of jaundice. The causes vary depending on the type. Pre-hepatic jaundice stems from conditions like hemolytic anemia, malaria, or autoimmune disorders. Hepatic jaundice is caused by liver diseases such as hepatitis, viral, alcoholic, cirrhosis, or genetic disorders like Gilbert syndrome. Post-hepatic jaundice results from bile duct obstructions, including gallstones, tumors, pancreatic or bile duct cancer, or pancreatitis. Newborn jaundice, a common and usually harmless condition, occurs due to an immature liver struggling to process bilirubin efficiently. 4. Symptoms and clinical presentation. The hallmark symptom of jaundice is yellowing of the skin and eyes, but other signs depend on the underlying cause. Patients may experience dark urine due to excess bilirubin excretion and pale stools from lack of bile. Additional symptoms include fatigue, abdominal pain, nausea, itching, pruritus, common in obstructive jaundice, and weight loss. Severe cases may present with confusion, bleeding tendencies, or swelling ascites, indicating advanced liver disease. Recognizing these symptoms early helps in prompt diagnosis and management. 5. Diagnostic approaches. Diagnosis begins with a physical examination and medical history, followed by laboratory and imaging tests. Blood tests measure bilirubin levels, direct and indirect, liver enzymes, AST, ALT, and markers of hemolysis. Imaging studies like ultrasound, CT, or MRI detect liver abnormalities, gallstones, or tumors. In obstructive jaundice, ERCP, endoscopic retrograde cholangiopancreatography, may be used for both diagnosis and treatment. A liver biopsy is sometimes necessary to assess tissue damage in chronic liver diseases. 6. Treatment strategies. Treatment targets the underlying cause. Hemolytic jaundice may require blood transfusions, steroids, or treating infections like malaria. Hepatocellular jaundice management includes antivirals for hepatitis, alcohol cessation, or liver transplant in severe cases. Obstructive jaundice often needs surgical intervention, ERCP for gallstone removal, or stenting for tumors. Supportive therapies include hydration, phototherapy for newborns, and medications to relieve itching. Early intervention prevents complications like liver failure or kernicterus in infants. 7. Potential complications. Untreated jaundice can lead to serious complications. Acute liver failure may arise from severe hepatitis, while chronic liver disease and cirrhosis develop from prolonged damage. Kernicterus, a rare but dangerous condition in newborns, occurs when bilirubin enters the brain, causing neurological damage. Infections like cholangitis, bile duct infection, can be life-threatening if bile flow is obstructed. Timely diagnosis and treatment are essential to avoid these outcomes. 8. Prevention and prognosis. Preventive measures include vaccination, hepatitis A and B, avoiding excessive alcohol, and safe blood transfusion practices. Newborns should be monitored for jaundice to prevent kernicterus. The prognosis depends on the cause. Newborn jaundice often resolves on its own, while chronic liver disease or cancer may require long-term management. With proper medical care, many cases of jaundice can be effectively treated emphasizing the importance of early detection and intervention. This structured breakdown provides a comprehensive understanding of jaundice, from its causes and symptoms to diagnosis, treatment, and prevention. Thank you for joining me on Medicallogy with Professor Farouk. If you'd like a more in-depth lecture or a PowerPoint version of this presentation, please let us know in the comments below. Your feedback helps us create content that serves your learning needs best. Don't forget to like, subscribe, and share with your medical students for more medical insights.